I pay tribute again to the incredible work of all those who are working in the NHS, especially over the last few months during this second peak, and it's been incredible. As I said in my opening remarks, these have been challenging times, and one of the challenges that we face as a country is in terms of the financial consequences of the pandemic. And so the evidence that was put forward yesterday was on the basis of affordability. Now, of course, elsewhere in the public sector, there's a pay freeze in place, and we've proposed what we think is affordable to make sure that in the NHS people do get a pay rise. And I think it is fair to take into account all of the considerations, the incredible hard work of those in the NHS, which means that they are not part of the overall public sector pay freeze, and also what's affordable as a nation.
Nurses are considering industrial action, and others may quit altogether following the news that they might receive just a 1% pay rise after a year of COVID-19. So my question is, how do you expect to stabilise the NHS and complete the vaccination programme without nurses on the ground?
Well, Megan, it's an incredibly important point that we need more nurses. Not just the nurses that we have now, and we have a clear manifesto commitment to 50,000 more nurses in the NHS, and I'm delighted that there's more than 10,000 more nurses who've joined the NHS over the last 12 months. Also, we've seen an increase in 34%, so more than a third, in the applications to nursing. And of course, over the past 3 years, nurses have had a 12% pay rise. And I bow to nobody in my admiration for nurses. In fact, I learned that at the knee of my grandmother, who was a nurse and worked nights at the Pilgrim Hospital in Boston. The challenge is that the nation's finances are tight, and whilst everybody else in the public sector is going to have a pay freeze, we are able to give to propose a pay rise for nurses at 1%. I entirely appreciate that reflects the difficult financial circumstances that the country is in.